So, as mentioned before, my name is Lois Delong. I work as a community connector based here in Lincoln as part of Bridge Church. And for a few moments, I'd love to share about the Lincolnshire picture and also highlight a few of our colleagues and partners that are on the call as well. As mentioned before, Mike Farley, who is another community connector, and Simon Hawking as well, the CEO of Axe Trust. So in recent years, Lincolnshire has been a part of the community mental health transformation, which has taken place through our local NHS Mental Health Trust through cross-sector working. So it was recognised that such challenges such as loneliness, isolation, and suicide were growing. And what was found was that a number of local people were presenting at GP practices, in the accident and emergency, and also through caseloads. And then additionally, it was also found that people who would present were often supported by the same organisations and groups in the community, but more often than not, it was found that groups would not communicate with one another, and many would often bid for the same funding pots. And so there was a need to break silo working to ensure that true partnership working was taking place. Across Lincolnshire and Lincoln in particular, faith-based organisations and groups have been known for building community well and always being present in the community, often rising to the occasion to support social action through the needs of clothing, food provision, and by providing a warm welcome. In Lincolnshire, this has been exampled through Transform Lincoln, the largest third and faith sector in Lincoln, often working in partnership with the local authority, NHS, organisations and people of other faiths. So with these presenting challenges, there was a need to work differently in order to address them, supporting people at all parts of the spectrum in regard to their mental health, particularly in a way that had not been done before. So through work with the public and then the VC FSE sector, roles such as social prescribing, which we've heard about from Dr. David, emerged, including other community roles, seeking to work in a close-knit manner with the NHS Trust and clinicians across Lincolnshire. So what was the vision? So together that we will promote well-being for all, enabling people with a mental illness, dementia, learning disability, or autistic people to live independent, safe and fulfilled lives in their communities. So the Lincolnshire picture tells a story of partnership. The undercurrent of intentional and mutual relationships has formed the backbone of our working. Through co-produced events and the introduction of strategic roles, the NHS has strategically worked with partners to test and try elements of this programme through piloting roles and events. And so over the years, co-produced events and forums have brought various sectors together through their work and annual AGM events in the community. Our programme lead, who's not here today, Victoria Slight, has worked so hard on this alongside several others who have championed this work. And we came up with such statements as evidence in the photo on the slide, such as we will pay attention to others and ourselves and their needs. We will make sure that everyone in our care is informed of their needs and goals, and making sure that we make no decisions about people without them, ensuring trauma-informed care for all. So the community mental health transformation over time has evolved into the Mental Health, Dementia, Learning Difficulties and Autism Alliance, bringing together partners from all sectors. In December 2025, the Alliance launched the VCFSC strategy for Lincolnshire, highlighting these 5 pillars as you can see on the slide. And as part of the VCFSC sector, both Bridge Church Lincoln and Axe Trust are members of this alliance representing the faith sector. So early partnership working addressed the need for third spaces, a home away from home for people to congregate and to meet, and equally have the opportunity to meet face to face with organisations and groups. A role that later formed, which I'll come on to in a minute, as community connectors, was also connected to community hubs, the creation of non-judgemental spaces that people could come in, enjoy a cup of coffee, groups and activities. If people were found to present in these spaces, as we heard earlier, Then localised NHS clinicians and teams were on hand to support making referrals should guests consent to this. And this also came with a growing vision of community hubs and wellbeing spaces being 15 minutes from every home. So this was later evidence, as shown in the slide, through the Bridge Central Community Cafe, often being referenced as the flagship for the county. So since then, this has formed itself across the west of Lincolnshire in partnership with several churches where many receive support. And as you can see, there was a £5.31 return on every pound spent regarding the social return on investment. And so as we continue our journey together in line with the NHS 10-year plan, as we move towards the direction of neighbourhood health implementation, we aim to continue this journey with further alignment of our working, bringing NHS partnerships together to support local people. And so the partnership strategy continues, keeping people as the focus and relationships as the backbone. Communication, collaboration, and respect have remained as values that continue to drive this important work into the future. And so for the past 4 years, community connectors in Lincolnshire have been working in a pioneering NHS commissioned role hosted by churches and charities, including Bridge Church. And this role, again, was created out of the rising loneliness and isolation and social need, as there was a lot of pressure on overstretched health services. So there was a clear need for people who could join the dots, someone who could build relationships, lead cross-sector partnerships, and help communities and services work together more effectively. And as connectors, our work falls into 4 main areas: partnering with statutory and VCFSC organisations, developing local partnerships, engaging with communities, and creating accessible community support. Unlike clinical roles, we don't carry caseloads, which means that we can be fully present in our communities, actively listening to local voices, understanding what matters to people, and connecting them to the right support. Placed across 4 primary care network areas in Lincoln and in the surrounding region, we work alongside social prescribers, peer support workers, and locality mental health teams. This creates a genuine no wrong door approach, whether someone needs help with mild loneliness or complex clinical support. We ensure that there is always a way in. Our role is fluid and operates at 3 levels, as referenced in the Theos report, also shared by Dr. David. At a neighbourhood level, we work very closely with the primary care network and frontline workers. At a place level, we lead on and build partnership networks that bring together faith groups, community organisations, and statutory services. And at a system level, we sit on steering groups, feeding local insight into local and county-wide strategy, linking decision makers with real on-the-ground experience. In every space, community connectors amplify the voices of residents so that strategy aligns with genuine community need. Relationship is at the heart of everything that we do. Through our partnership networks, by leaving organizational agendas at the door, we create a culture of shared purpose where partners work toward a common goal, improving the mental health and well-being of local people. And this collaborative approach has led to tangible outcomes, from training partners across sectors regarding autism and ADHD to multi-agency work on hoarding that now connects local partners with county-wide and even national networks, and much, much more. The multiplicity of this spreads far wider per geographical area. It has also led to a key expression of our partnership working with our wellbeing hubs, as referenced before. This is just a shot of the Bridge Central Wellbeing Hub. And these spaces offer daytime support for people experiencing isolation, anxiety, or lower level mental health challenges, creating a space where they can feel safe, known, and connected. So these wellbeing hubs operate across the county, and they're signposted through by GPs and partners through also a website called How Are You Lincolnshire, a platform that helps people to navigate support close to home. And for many, these hubs can be the first step towards stability, fulfilling the simple but powerful goal of helping people to find a job, a home, and a friend. So ultimately, the community connectors act as the glue between communities, churches, faith groups, charities, and the NHS. And by joining the dots and keeping people at the forefront, we help to build connected, resilient communities and contribute to long-term improvements in local well-being. And now a quick segue to another great part of the mental health and well-being offer, which complements existing work previously mentioned, our night-light cafes. So our nightlight cafes are out of hours, safe spaces that offer non-clinical mental health support in the form of listening, provision of activities, and signposting advice. The nightlight cafes came into being through a partnership between the Lincolnshire Integrated Care Board and a network of local churches, and it sits under the umbrella of a local Christian charity, Acts Trust, as mentioned. Beginning in Lincoln in 2020, in the height of the pandemic, and expanding around the county in 2022, there are now 27 nightlight cafes in Lincolnshire hosted by local churches and charities, including university campuses. Nightlight cafe provision also includes a twilight cafe, which supports young people and their families with regards to referrals from CAMHS. Because of nightlight cafe provision, this means that every day of the week, there is a building with the lights on where local people can receive a warm welcome, community, support, and friendship, being signposted to mental health support where appropriate. Last year alone, there were 18,000 attendances across the network, and this figure has already been surpassed in 2025. Acts Trust currently have almost 200 people volunteering with the project, and many individuals have reported that the support they've received in these places has helped to divert them from using clinical services and aided them to connect with their local communities. So here is a case study from the nightlight cafes. So Kay worked in the mines for most of his career, but had a workplace incident that meant that he was no longer able to perform physical labor. He struggled to get access to medical care and ended up losing his family. He moved to a caravan near the coast and became isolated and depressed. And some years ago, he attempted suicide by hanging, but was discovered by his father and rushed to hospital. And since then, he has been medicated for depression, but finds that his mood swings upwards and downwards unpredictably. Kay did not want to attend the night cafe in his hometown, so decided to drive to the nearest cafe, which was in Louth. And he's a very open person and has discussed this situation with volunteers and other guests, as well as providing one-to-one and community support. The team signposted Kay to their local NHS community connector, who has been able to supply electric heating equipment and home ice insulation products to make his caravan more comfortable in the cold weather. And Kay says that the nightlight cafe has been a lifesaver for him. If he wakes up feeling down, the thought of coming along and seeing some friendly faces helps him to manage his feelings of isolation and depression without spiraling towards suicidal thoughts. Thank you for listening.